Welcome everybody to our exciting three-part series. My name is Dr. Stephanie Wu. I'm the founder of Wu University, and it's my pleasure to present such an exciting and requested series. So the title of this event is How to Build and Grow a Specialty Lens Practice. And kicking everything off is Dr. Elise Kramer and myself. Super excited to be here with everyone. Dr. Kramer is residency trained and she lives and practices in Miami, Florida. She got her degree of optometry from the University of Montreal in 2012. And then she completed an ocular disease residency in Florida. She also is a fellow of the Scleral Lens Education Society. And on top of that, she is the public education chair for the SLS. If anybody's not familiar with the SLS, such an incredible nonprofit organization. She's also a member of the AOA, the BCLA, the IACLE, and she is a fellow of the American Academy of Optometry. Dr. Kramer loves helping specialty contact lens patients. I have personally visited her practice. It is absolutely fantastic. The patients love her. She is doing such incredible work at her clinic, and it's my pleasure to be here with Dr. Kramer today. My name is Dr. Stephanie Wu. I graduated from SCCO, and then I completed a cornea and contact lens residency at the University of Missouri in St. Louis. I owned 3 practices in Arizona and California, and now I'm on to a different venture where I own a specialty contact lens clinic in Las Vegas, Nevada. That's all I do now. I don't do primary care. I don't have glasses or optical anymore. I just practice specialty lenses. So super excited to be here with my dear friend and colleague, Dr. Kramer. So take it away, Dr. Kramer.
Oh my God, it's such an honor to be here. I love this, and I just can't get enough of talking about specialty contact lenses with you. You're a huge inspiration to me, and I think we both love bouncing ideas off each other. So it's an honor to be here. Thank you for this prestigious invitation, and I'm excited to start this session. So this is a great photo. So basically what you see here is a vending machine with contact lenses. And this is actually a real photo. And it was at the World Cup back in Russia a couple years ago. And the reason I wanted to put this photo is because it scares me. I think this is like a scary kind of future of what contact lenses look like already and what might look like on this part of the world soon. Basically, the way it works is just like any vending machine, you put your money in there, select your prescription or what you want, basically the brand you want and the number, and then you put your money and then you get your lens. So this is scary because, as we all know, contact lens is not a candy bar, it's not a bag of chips, it's a medical device. And so what happens is when patients start being able to choose that, it takes away, kind of cuts out the middle person, which is us. And so what do we know? What we know about contact lenses is that, you know, no two eyes are the same. And this basically shows that the differences in different topographies and different corneal shapes and sagittal heights and everything can be different from one patient to another, and certainly from one eye to the other. So how can you go to a vending machine and just pick out a lens, the type of lens that you feel like wearing? And so how do we avoid that type of thing? And I think the key here is to be able to sell or to offer something that you cannot buy in a vending machine, something that you can't just purchase online or on a corner store, something that is different and something that is unique. And that's where specialty lenses come in. And I think one size does not fit all. And I think that it's important to not sell contact lenses, but actually fit them. And that is what a specialty lens practice does. So what is a specialty lens practice to you, Dr. Wu?
Yeah, so specialty lens practice, I would say that it's a practice that you are fitting types of contact lenses that most practitioners don't fit or fit very few of. So in our case, we're fitting a lot of gas permeable lenses, hybrid lenses, scleral lenses, some of these really innovative technologies. But I also think it could be on custom soft lenses. So sometimes there's doctors that they're not real comfortable when the prescription gets out of some of the standard parameter ranges, and then they send them to us because they're like, "Ooh, I don't know what to do with this person now." So even just like a soft specialty lens, I think could qualify. So I think that a specialty type of practice is one that you have, that I have, that Dr. Morrison has, Dr. Fergrozo. I mean, it's where we are focusing on specialty lenses. And I know with you, Dr. Morrison, Dr. Fergrozo, you guys all practice primary care and have and some of you have opticals as well, but you guys also have a major emphasis on specialty lenses.
Yeah. Yeah, so I think the key is just being able to offer something that is not like, how can you compete with an online website or a huge chain, right? You have to be able to offer something that you can't buy online, that you can't buy in a vending machine, because ultimately the skills that you acquire in fitting specialty lenses, those can't be replaced by the click of a button type of thing. So you were talking about just not having an optical. So can you expand on that a little bit?
Yeah, well, for me, I decided a while back, after having an optical for 10 years, I just said, well, what am I really good at? And what are some things that I love doing? And for me, it was specialty lenses. So I just had this vision of developing a practice that was just specialty lenses only. And there's several people in the US that have those types of clinics. And I thought, you know what, if they can do it, I can do it too. And so that's where I kind of got the courage and confidence. And like you said, Dr. Kramer, that picture that you first showed with the vending machine that's happening. And I don't think it's going away. I think it's going to happen more and more around the world. And who knows if that will end up happening here in the US, but that is scary. And I think a lot of doctors they're always worried about competing with online companies and big box and some of these bigger names. And I really think that some eye doctors are realizing, well, maybe we should be doing something else. Maybe there's something different. And I really think that's where specialty lenses shine, is we can offer this type of service and product that patients are not going to be able to just get online or through a vending machine. I mean, at least not right now, maybe in 100 years or something, like when science and technology becomes really, really good or something. But for now, I think we should just be focusing on what we're really good at as optometrists. And I think for us, it's doing specialty lenses.
Absolutely. Absolutely. And we'll talk about that a little bit more, like about how to set it up. Can you not have an optical? Can you have an optical? What are the pros and cons? We'll go over that in a little bit. But I just want to talk about this for a second. So what is this? I want to show that, basically specializing in contact lenses is really a niche, a huge, because if you look up the different conditions that, we treat, like this is a Google search. So how much do people look up Stevens-Johnson syndrome? That's a big one. Keratoconus, dry eye and pellucid. So you can see in terms of size, that represents basically the amount that people look this up, right? But if you compare that to diabetes or glaucoma, it becomes a lot smaller, right? And if you compare that to Kim Kardashian, all of it becomes kind of, not irrelevant, but just really, really small. So this is the niche, this is a huge niche practice. It doesn't mean that there aren't patients who need us. But what I'm trying to show here is that this is a specialty. The vast majority of people are not looking for this type of service, but If you offer specialty lenses, you're helping these people here who may be having severe issues, and as I mentioned, it is a niche practice, but these people need our help. So what within the profession of optometry, where do contact lens specialists practice? Well, 19% of them are in universities, 52% are actually in private practice, and 29% are going to be MD/OD kind of private practices. So most contact lens specialists practice in private practice, like you and I, Dr. Wu. And optometric specialties are not necessarily officially recognized, right? You can call yourself a contact lens specialist, but it's not like an official specialty like an oculoplastics or retina. You know what I mean? But what's important is referrals are commonplace. So we'll talk a little bit more about referrals, but these can come from a bunch of different places. A big one is, again, patients kind of referring themselves in by looking things online and finding your practice. And then, they can come in from ophthalmologists or other MDs, group referrals, or even other optometrists. Dr. Wu, what do you think about these referrals? Where are you getting the majority of your referrals from?
Yeah, that's a great question. And I think it's something that people ask us all the time when we're at meetings and when we write articles and things. That's one of the number one questions, how do I get more referrals? So when I was in regular private practice where I was seeing regular eye exams and doing glasses, contacts, and specialty lenses, I would say when I first started, most all of my patients were patients that I saw within my own clinic. And I kind of mentioned specialty lenses to them, whether it was they had a corneal scar and they didn't see their best, or they had keratoconus and they weren't doing anything about it. Maybe it was somebody that had a very high prescription, and I got patients all the time from all walks of life that would always say, yeah, I want to do contacts, but I was told, like 30 years ago or 5 years ago, or even like 1 year ago from another eye doctor that, my astigmatism is too high and I will just never be able to wear contacts. I mean, I was getting that type of comment almost on a daily basis. So that just kind of creates an opportunity to say, hey, you know what? If you want to do contact lenses, I definitely think we can. We've got different options now. And I really think that it's something that we can pursue if it's something that you really want to do. And what about you, Dr. Kramer? When you first started, where did you get most of your specialty lens patients from?
I think it's so interesting that you just said that, because that shows how you can convert a primary care practice into a specialty practice just by finding patients in your own office that are already coming to you just for a basic eye exam and converting those patients into a specialty patient. That's super interesting. And I think that is a huge opportunity, as you mentioned. But at the beginning, I think I was trying to do that. But what I also did is I tried to reach out to other doctors and say, I'm offering this service. I do specialty lenses. And at that time, I don't think there were as many people that were involved with specialty lenses. So it was a little bit more kind of, I would say, competitive. But even if now there's a lot more people doing these type of lenses, it doesn't mean that you can't be successful. And I think what you just mentioned is really gold, like just converting your own primary care patients, especially if you're in a primary care practice, just converting those. Like I've realized that being in working in primary care, some patients are super interested in contacts, but if you don't ask them, hey, do you want to try contact lenses today? They will never even mention it. And so just converting a basic comprehensive eye exam into a specialty contact lens exam, that's huge. So that's really cool. So where else do referrals come from other than, let's say, your own patients in primary care?
Yeah, so this is something that we talked about last time, and it's super important. So let's say that you've got your practice and you have the patients that you can convert from your own existing patients, but there's many other places. So now in my new practice where all I do is specialty lenses, I don't have that opportunity anymore where I'm seeing somebody for a primary care exam and then I can kind of talk to them about different options. So I would say 95% of the patients that we see now come from other clinics. So other doctors that have seen a patient and let's say they've got keratoconus, they send them to us, or they've got a transplant, or they've got extreme dry eye, or even patients that they just they want to wear contacts, but the prescription's too high. I mean, so we're getting a lot of these referrals and building a network of trust among the individuals here in Las Vegas. And then the other patients are either people that find us online, as far as searching like the key term and then like reading up on different doctors. And I know we'll get into that as far as how important it is to have a very strong online presence, making sure that you've got a very good website that describes what you do. I mean, I just saw a patient or a doctor that was getting like coaching from me on like how to build this specialty practice, and his website had nothing about it at all on specialty lenses. So I kind of asked him the question, well, if you were a patient and you were looking for a doctor that did a certain service and you looked on their website and it didn't mention that at all, would you have a lot of trust in that doctor? And he was like, no, if I needed like cataract surgery and I went to a doctor's website and it didn't say anything at all that they did cataract surgery, like I would not go there. So I'm like, yeah, you've got to have these types of online really strong presence. But I know that for you, Dr. Kramer, you are one of the people that told me about some of these referrals. So you were the one that said, go to the corneal specialist, go to the general ophthalmologist, go to the dermatologist, the oncologist. I mean, can you kind of talk to us about how did you figure out that those are the people that you needed to talk to get referrals?
Yeah, so when I studied, as I mentioned, in Montreal, and I knew all the ophthalmologists there, right? Montreal's a small island, and I already knew everybody. Then I came here, and I knew nobody. Like, I didn't know any of the ophthalmologists. And then I think doing a residency here kind of like helped me get into that network. But even if you don't do a residency, okay, like, doesn't mean that you can't introduce yourself. And it takes some guts, but for sure, I think knocking on doors is what got me to where I am now. I just went and introduced myself to a lot of different doctors, and some of them I have very good relationships with. I hang out with them, but it doesn't have to be like that. Just introducing yourself. I even brought like a scleral lens fit set with me, and I showed them, look, this is what I can do. This is what I use. I have, this type of equipment. And I'm not just saying MDs, I think that there are so many other doctors who can benefit from what we do. It's all about co-management, right? So even if you're an OD, okay, some ODs don't have the desire, the resources, the time. Some ODs are seeing 40 patients a day. Dr. Wu, you know what that's like. But I mean, you did specialty lenses even when you were doing that. But what I'm saying is some ODs don't have the equipment. Like they don't have a fit set in the office. They may not have a keratometer or a topographer, and they may not feel comfortable fitting these patients. And those are a great source of referral. And other doctors. So for example, like a graft versus host patient that's seen by an oncologist, or someone with autoimmune problems is seen by a rheumatologist, or hormonal issues by an endocrinologist, ENT, that's a great source of referral too. So, although you may not get as many as from a cornea specialist or a general ophthalmologist or retina specialist, there are so many sources of referrals. How are you getting referrals now from other ODs? Like, was it an issue for you to do that?
Yeah, well, I'm glad that, you shared your experience of what you did when you first moved to Miami and started your own clinic, because, and I think it goes to show why you're so successful, because you going to these doctors' offices with that fit set and just saying like, "Hi, I'm Dr. Kramer. This is what I do. This is how I can help your patients." 90% of eye doctors will not do that. And I think that's what you really have to do if you want to have this be a part of your practice. You have to have the guts to go out of your way and knock on doors like you said. And I think that I think that's something like a key thing for listeners is that if this is something you really want to do and you really want to try to get more referrals, you have to make those face-to-face interactions. Even if it's like 1 minute, you're waiting, you show up with a box of donuts and you're like, "Hi, I'm Dr. Kramer. I would love to meet Dr. Smith. Do you think they would have just like 1 minute to meet with me?" And that's what I think both of us had to do when we first started these clinics is kind of go door to door and just kind of let people know that we're here and kind of what we can do. And I would say that the Las Vegas optometric community has been very, very kind to me, and they received me very well. And I remember talking to a few friends that also do a lot of specialty lenses, and they've got like a heavy emphasis practice. And a lot of them were like, "Optometrists are never going to refer to you. You should spend all of your time with ophthalmologists," and I don't think that's true at all. I think that there are plenty of optometrists that have no desire to do this, or they don't have the equipment. Like you said, Dr. Kramer, it's not something they want to do, and they have no problem sending them over, especially now with my new clinic where I don't practice primary care anymore. There's no threat in them for them to potentially lose that patient to me, because that's not something I do anymore. But for you, Dr. Kramer, what would you say as far as some of these other practitioners like that are not in eye care? How did you make connections with like an oncologist or a rheumatologist? What are some kind of key things that we can help the listeners with? How do you even start that conversation at all?
Yeah, so I think that that's a little bit more challenging because they don't understand the eye as much as like an ophthalmologist would, of course. Um, and unfortunately, I think the eye pathology is not very well, like they're not very well exposed, so they may not know that what it even means to fit specialty lenses. So it's a little bit more challenging, but definitely not impossible. For example, I talked about graft versus host disease, and that's a huge thing, but it's not limited to that. There are patients, for example, here in Florida, or I'm sure out in Nevada as well, or other like warm places where people have a lot of skin cancer issues and they get a radiation on their face. Well, what are you doing with radiation? You're obliterating basically all the meibomian glands. You're causing severe dry eye. And that's where we come in, and with a scleral lens, I mean, we can restore the ocular surface. So these are things that you can share if you have any connections with any hospital or any colleagues that are oncologists. This is something that you can tell them. Rheumatologists too. I mean, these patients are dry. Like these patients need us, Steven Johnson syndrome. Even general practitioners. Look, general practitioners, these patients are diabetic. Diabetes is also a risk factor for dry eye. Dry eye, I mean, it was mentioned in TFOS-2 several times that scleral lenses are one of the main treatments for dry eye. So like you said initially, converting primary care patients into specialty patients, I think there's so much potential there. And I think one thing that you've done, Dr. Wu, that's genius is actually remove the optical. And that is something that takes a lot of guts because that's a source of revenue for optometrists. But doing that it basically you're saying to other optometrists, like, I'm not competing with you. I'm working with you, you know, because other optometrists, and with reason, are going to be afraid of losing their patients to you because you can do it all. You can do a dilated fundus examination. You can do, you can sell them a pair of glasses, but you're not doing that. And I think that shows like, okay, I'm just your contact lens doctor. This is your regular doctor. And I think that's huge.
I have a question for you, Dr. Kramer. So because you have an optical and you do primary care as well, what happens, let's just say, because this has happened to me before in my other practice, but patient comes in, they're referred by another doctor, let's say for keratoconus, and they're referred to you and they get their fitting. And then they see that you have an optical and that you're doing these other things. And they say like, well, can I just come to you instead? You know, it's just easier, so I'm not having to go like back and forth. Or like if there's a pair of glasses that they want to buy from you, how are you handling that type of situation?
It's tough because technically I can do it all, you know, but I'm really trying to focus on specializing. And also, the only way to maintain that relationship with the referring doctor is by not accepting that. You know what I mean? Unless, you know, if you want to maintain, it's called co-management, right? So yeah, I could do it, but I'm going to tell the patient, no, like, I am your contact lens doctor. That's the way I tell them. I would rather if you go back there for your glasses and your general eye exam. Doesn't mean I can't do it. I just don't want to because I want to maintain that relationship. And I think that's important. And I always send a letter after seeing a patient back to the doctor. And I write at the bottom, I told the patient to return to you for all vision care needs. It's just for contact lenses. And I think that's important. And obviously, I don't think you have as much of that issue because you're not doing primary care or optical. But I think it's important, especially when working with optometrists, because it is competition. You know, it definitely is. So, but how do you become a specialty lens expert? Do you think that a residency is kind of a lot of people ask me, a lot of students like come into the practice and they say, do I need to do a residency to become a contact lens specialist? What's your opinion on that? Or
Yeah, well, I think there's a lot of different ways to get involved with specialty lenses. There's no one path. I think that we all know that you can do a residency. I think that absolutely helps because you have an entire year that you are dedicated to specialty contact. So I would definitely say that my residency is that was one of the main things that catapulted me to where I am today. So if there are any students listening, if you think this is something that you're interested in, I would highly recommend doing a residency. And it doesn't have to be in just cornea and contact lens residency. You can do something like Dr. Kramer did, where she was doing an ocular disease residency. There's many residencies where you also get to fit some of these contacts for these patients. Just like you said, Dr. Kramer, people that have Stevens-Johnson's and graft versus host and Sjogren's. I mean, these are all patients that you're going to see as part of a disease residency, and that just gives you an opportunity to fit these types of people. If you are out of school and you're practicing already, that does not mean that it's too late. You can absolutely integrate specialty lenses into your practice. Some of the ways that I would highly recommend would be following Scleral Lens Society. They've got tons of archived webinars that are free. GPLI, the Gas Permeable Lens Institute, they have tons of free content and all sorts of different things. And then meetings like you're showing here. I think that if, let's say that you're out of school, you're in your practice now, whatever modality you're in, and you're like, you know what, I would like to do this. One of the best things is attending some of these meetings and either doing workshops where you are physically handling specialty lenses and trying them on patients' eyes and kind of learning how to handle the devices and assess them. And even just going to some of the continuing education lectures, just like we're doing now, you know, our goal is to teach other doctors how to integrate this into practice. So Dr. Kramer, is there anything that I'm missing that you would also recommend?
No, I think that I think my path was maybe a little bit different than most contact lens specialists. Like you said, there's not just one path to success. I think there's many ways. If you want to do it, I mean, when there's a will, there's a way, right? I personally had really good training at my school because I had the opportunity to work with Dr. Michaud, Dr. Langis Michaud. And then after I felt comfortable already fitting lenses, and I did so in my residency, which was ocular disease. But if I had to like tell a student, you know, what they should do to kind of break through in the industry, I would say the contact lens residency is probably the best way to go. It's not the only way, certainly. And if you're out of school and you're not, you know, doing a residency or thinking about doing a residency, you can always do an apprenticeship. A lot of people like Dr. Wu and I, we love teaching. We love doing workshops. We love, you know, you can go to so many meetings. There's like a bunch of these that I put up here. And there's so many online opportunities to learn. Yeah, like I said, when there's a will, there's a way. And there is no shortage of lectures, of workshops. So just to take advantage of all of that, for sure. So how do you start, Dr. Wu? You just did this. So you just went through all this. What do you recommend? Like, what's the first thing you should do?
Yeah, so I think one of the first things I did was I talked to a lot of colleagues. So I reached out to you and Dr. Fergrozo and Dr. Morrison, and we've been on this journey together. We kind of thought about doing something similar kind of around the same time. So I reached out to a lot of colleagues in the industry and kind of told them what I was thinking, because I thought that if people told me like, you know, that's going to be just way too difficult, I would have like respected that and maybe gone about this a different way. You know, maybe started a practice like I had before with specialty lens emphasis, and then kind of go through this path and then kind of drop off some of the other things. And during kind of my conversations with people, that gave me a lot of clarity that once I started talking to a lot of people were like, you can't give up the optical. You absolutely have to do that. That's like the bread and butter of optometry. And I would say, well, you know, what about some of the primary care optometrists that I would like to refer to me? You know, what about that? And some people were like, oh, well, you're never going to make everybody happy. So I think I just had to sit with some of the conversations that I had with people and then figure out for myself what I genuinely wanted to do. And that's kind of where I started. And then once I figured out, you know what, I am not passionate about optical. I never have been. I was the worst person in optics lab when we were creating glasses. I remember one case where I made the bifocals upside down, like the seg height was up here. I'm like, oh my God, I'm clearly like, this is just not my thing. But, you know, owning a practice, you have to, with glasses, you have to like embrace somewhat, but that was never my passion. And so I just said, forget it. I'm just not going to have it. Worst case, if this practice goes south and it just doesn't work out, I can always add in the optical. I know how to do that. I've done it before. I can add that back in. Same thing with like insurance. Everybody was like, you have to take insurance. It's really important. That's something that you probably want to do as a beginning practice. And again, I kind of thought about it, looked into it. So originally I was like, all right, I'm not going to take any medical insurance because those don't pay very well for specialty lenses anyway. So I'll just take vision insurance. But the problem was, if you accept vision insurance for medically necessary contacts, you have to also have an optical with at least, it's like 200 frames. And you also have to practice primary care. It says that in the provider manual. And because I was so committed to not having an optical and not having practicing primary care, I was like, okay, well then the only way to do this is to do this cash model clinic and not take insurance at all. And like I said, worst case, I do it for a few months and then it's not working out. I can always go back to doing primary care. I can go back to integrating optical and taking insurance. Luckily, you know, we're doing great. We haven't had to do that, but I think those are just some of the things you have to think of. The other thing that you've got here, Dr. Kramer, right practice at the right place at the right time. We have very different practices as far as the reason I chose Las Vegas is because there was nobody here that was practicing specialty lenses at a very high level. Not saying there's not doctors here that don't do it. There's plenty of great doctors here that fit specialty lenses. But when I went on the Scleral Lens Society, like looking at the provider locator, there were no fellows of the Scleral Lens Society in the whole state of Nevada. Same thing with iPrint. I went onto iPrint, see if there's any practitioners, nobody in Nevada. So I thought, wow, this could be a really amazing opportunity. And that's why I picked Las Vegas. But for you, Dr. Kramer, yours is so different. You know, you are in Miami where there's lots of other people that fit specialty lenses. So how did you come to that decision that, you know what, even though there's other people here, I am just as good and I am going to do this?
I think that one thing that's important in any business is that you can't be afraid of your competition. I think there's enough keratoconus to go around. For example, there's a lot of different conditions that we can treat. And I think that even in being in a saturated area, you can stand out. You can stand out by differentiating your practice, by offering something different than everyone else, and that by marketing in a different way. I'm not afraid. Like, I have doctors call me sometimes and I help them on the phone fit lenses, and I don't mind because I want, and that's why I teach it too, because I want other people to do it. There's so many people who need this type of service, but that doesn't mean that I can't be extremely successful at what I do, because I offer different things than maybe the practice around the corner. There's someone on the same street as me that does specialty lenses, but we're both doing okay. Like, we're both doing fine, and he has his patients and I have mine, and that's okay. And I think that, yes, it's great to move to an area where there's not a lot of competition, but if you happen to be in an area that there is, like I did, then you can still make it. And I think that's important. And I think the key is standing out. And we'll go over a few things. How do you stand out in a little bit? But I think that's the key component into being successful, even when there's a lot of competition around.
So I think we'll skip the question slide for now. We can just kind of go over that at the end.
Yeah, so let's talk about, what do you really need? There's obviously so many nice toys and things available that obviously if we could have it all, we would. Obviously, these things are expensive. And I think one of the questions is, especially if you're starting out, is what do you really need? And what you really need is the following: fluorescein, saline, a fit set, and a slit lamp, and obviously some sort of method of measuring Ks. That would be the most basic. But the reason I'm saying that is because we talk about what you need and what you want. Okay. Obviously, if you have the opportunity to get a topographer or a scleral profiler or an OCT, you might save a lot of chair time. You will save a lot of chair time. You will have more precise measurements. You might be more successful a little bit faster with some patients. But obviously, these are luxury items. And I think, again, you want your practice to stand out, then I think it's important to invest in some of these devices, especially the four I just mentioned: the topographer, scleral profiler, anterior segment OCT. But if you can't, that's okay. I think you can still be successful even if you don't have these things. But if you can, I would get them. What's your opinion on that, Dr. Wu?
Yeah, well, I think that this is a question that comes up a lot for us is, this is something like I really want to do. What do I have to get started? And I think you hit the nail on the head with just you've got to have a slit lamp, obviously. You've got to have a fitting set. You have to have saline, you have to have fluorescein. Those are like the things you absolutely have to have. And in my first practice, because the practice didn't do any specialty lenses before I started, this was a very well-established clinic. We didn't have any of these other things. We had an OCT, but it was only checking posterior segment. So I did not have the luxury of working with an OCT when I first started practicing. So I basically had to do all of my fits and make any changes as far as troubleshooting just by some of the slit lamp things that I had. I think what will help doctors listening in tremendously is, let's say you're like, I'm not in a position to purchase all this like crazy equipment because it's expensive and financially it's just not the right time. Totally fine. I think what will really help is if there's a way to take some sort of image at the slit lamp, and that it doesn't have to be like some fancy system. Like I have a really fancy system now where I can take slit lamp images and videos, but when I first started, I didn't have that type of funding. And so I just got a super cheap slit lamp camera adapter. So I basically had my phone and it like attached, it was like a piece of plastic that just attached and it kind of hugged one of the oculars. And then I just used my phone camera to take an image. And that was an incredibly cost-effective, super easy way to take images. But that's really helpful because when you send the images to the laboratory and the consultants, they can look at exactly what you are looking at. So I think that if I had any piece of advice, like for a practice that was like, well, I just can't afford a lot of these big ticket items, totally understandable. But just that would be like the first thing I would maybe invest in. And then after that, maybe getting like a topographer that's like refurbished. When I first started my new clinic here in Vegas, I did not have the funding to get a Pentacam. I'm like, I will get one when I get to that point where I can spend that type of money. But for now, I can't afford something like that. So I don't think that that should discourage people. I think that if you have some of the basic things, you can get started. And the consultants are amazing. They will help you. So if you have questions or you have issues, like they will help you with these fits. So Dr. Kramer, what are some of the things that you had at first when you first started your practice? And what are some pieces of equipment that you have added on?
Yeah, so first I just want to show this photo. This was taken, I don't know if you could really see it, but you could see blanching there just in that corner. And I took this with my smartphone. This is an iPhone and it doesn't even have an adapter. So there's a lot of things you could see with the naked eye. You don't need a slit lamp, and sometimes slit lamp kind of will bleach out. Yeah. So I think that you can do a lot of gross kind of measurements and evaluations without a lot of this fancy equipment. Like I said, I think a lot of this equipment will lower your chair time and improve your success, at least with initial fits. When I started, I was renting space in someone's optical. I had a slit lamp, I had a fit set, had fluorescein and saline, and I had this auto K device. And yeah, it took me a little bit more time than it does now. Also, I was like not as experienced as I am now, but I was still fitting, tough cases. I was still getting more and more referrals, and I was handling it. So I think again, as you increase your patience, then it makes sense to start investing in things. And obviously, that old rule is like you can't make money without spending money, and you do have to invest at some point in some of this stuff if you want to specialize. But I think initially, you can get started with very little things. And I think one thing that I was talking about making your practice stand out, I think the scleral profiler is something that is just patients don't see very often at other offices. And they're very impressed with that technology. And if you show it to them, they'll be like, wow, I've never had this done. I've never seen this before. And that's something that you can really use to kind of show how your practice is different from the practice around the corner. So what do you do? Like, let's say you have a patient that's coming in for a specialty lens. Like, what is your process? Like, what is it that you do initially with these patients? What devices do you use?
Yeah, so this is going to vary based off of what type of equipment that people have, but I think what we do now is basically kind of everything you've got, where we're getting a case history, we're finding out what have you tried before, if anything. Did you wear lenses in the past? Have you ever worn anything, or is this going to be your first time? You know, what's the diagnosis? Those types of things are important to collect in the beginning. Checking their vision with the naked eye versus with maybe like their best corrected glasses. Checking their topography, you know, that's like a standard now as far as information that's collected on their visit. I check their pachymetry, see if there's any areas of concern. So, you know, to figure out which lens option might be the best. And then checking with the slit lamp, seeing what you're seeing on upon gross observation, and kind of seeing where the cornea is at, where the ocular surface is at, any other anomalies. And then for me, I also incorporate posterior segment imaging and like a wellness scan as far as the RNFL and the macula. And that has come with time, because I've gotten burned a few times where somebody was referred to me for keratoconus. You know, they only see 2200. We're doing all this work, and it's like they're not seeing better. And I'm like, God, the fit looks great. I feel like the prescription is accurate. I don't know what else to do. And then it ends up, when I do a scan of their retina, it's like, oh, they have a macular hole. Okay, well, I didn't think of that. And so now that I have burned myself a few times, I've just incorporated that in part of the consultation. You don't have to do all these things if you're having a patient that's coming in for a consult. You absolutely don't have to do all of these. This would be like a very, very thorough consultation. But Dr. Kramer, out of all these different things that we see here, you know, this is what you would do for sure. Like if you've got, this is all you do, and you want to do something very thorough. But what do you think some of the key baselines are if somebody doesn't have like all of this fancy equipment?
Yeah, I think topography is a really good way of determining sagittal height. A lot of our lenses now are being fit that way. Not just scleral lenses, also custom soft lenses. But if you, again, the scleral profiler for me is just something that I think is really great to have. And I think that the other things, if you can, add them, I think anterior segment OCT, slit lamp cameras, as you mentioned earlier, is probably like those are probably like the four big ones. What about you? Like aberrometry, is that something that is on your priority list, or like, is that more of like a kind of like a bonus device for you?
Yeah, so I think different doctors that have an aberrometer kind of do it different ways. I have used it more as like a troubleshooting device, especially if somebody has come in and they're already wearing specialty lenses, but they're still complaining of some of the HOAs like ghosting and halos and things. I will do it on top of their lens to see if there's any room for improvement there. But and I had thought about just incorporating it in to my initial consult for everybody, but it was just taking too much time, and some of the results were a little bit hard to read because their surface was so irregular as far as their cornea goes. So now I just use it more as a troubleshooting thing, or if they're here specifically for that type of lens. But it's definitely something to offer, especially for patients that have some of those residual HOAs.
So we talked about corneal topography. I think having a pentacam and getting that posterior cornea can help, especially keratoconus is probably one of the most common conditions that we see as specialty lens practitioners. Just being able to kind of confirm the diagnosis, I think having that posterior topography at curvature and elevation is really useful. But you know, and it's useful also, I think, to measure lens flexure later on, like you were talking about troubleshooting, also tear film evaluation. Is it topography, like now with a scleral profiler that also does corneal elevation, do you still use a topographer as much?
Yeah, I still do. And I think it's just because I like to have, I think multiple pieces of information are better. Somebody in like just a traditional practice may not need to do like all of that work. But for me, being like dedicated to specialty lenses, I still do a regular topography. And then I also use a profilometer. I think that profilometry is great because we're mapping the shape of the entire eyeball, which is what most topographers cannot do. Most topographers really great at mapping the cornea, but once you get out past the limbus, not much data that they are able to capture. So these three different devices, the Pentacam with the CSP software, the Eaglet ESP, and then the SMAP 3D, these are three incredible instruments that have really taken our fittings to the next level. And I would say that most patients in our practice now, for my specialty lens practice, are getting a profilometry measurement. And it really helps me look and say, okay, we're going to have some issues here. If we fit a traditional, regular, standard scleral lens, it might take us a while to get to the end result because of how irregular your eye is. Or let's say they've got a giant pinguecula or a pterygium that we're going to have to vault over. So some of this amazing technology has become like so valuable. And I know, Dr. Kramer, you had said in the past, you know, with your profilometer that it's like you can't practice without it. Can you kind of touch on that?
Yeah, I just think that it gives you so much useful information that you wouldn't have otherwise. And it helps you troubleshoot without having the trouble, kind of initially designing the lens so that you have a higher success rate. Like I've been able to dispense so much faster without having to troubleshoot. So for example, you alluded to a giant pinguecula. You see that show up on your scan, like for example, on this image here, in this larger topography image, you can see like how much that's affecting and how much it would affect your fit instead of just receiving your lens, putting it on the eye and seeing how the eye responds. You can already kind of predict that with this device. And that is a revolution because we didn't have that before. We didn't have that ability before. So before it was trial and error, which is good and it works, but it's definitely more time consuming and requires more patient visits. So you can literally cut that time in half or more by having some of this technology. So I just think it's life changing. And then
It's incredible the amount of technology from when we graduated optometry school to now. I mean, even when patients come in and they say, I've had this scleral lens, it's 15 years old. I'm like, oh my gosh, like there's so much better technology nowadays that we could take advantage of. So I think we're going to conclude the first hour, and thank you, Dr. Kramer, for joining us on this amazing. I mean, we barely got through even half of what we wanted to talk about, and maybe we'll have time at the end for more questions. But as we are switching over to Dr. Fergrozo's lecture, I'm going to ask you a few questions, Dr. Kramer, if you don't mind.
Of course.
Okay. There was a couple questions here that I wanted to ask you. Okay. So Dr. Kramer, I am a registered optician in Ontario, Canada, where fitting specialty lenses is within our scope of practice. I'm in the process of building my specialty lens practice where I don't sell glasses. As an optician, My expertise is less in the medical applications, more in the niche geared to healthy eyes needing contact lenses. My question to you is, do you serve healthy eyes with specialty lenses such as hybrid lenses or other lenses? What are your thoughts on this niche? I've had a lot of patients responding to my marketing campaigns, so it seems like it will be much easier to attract them directly instead of seeking referrals. Thanks so much for your feedback and excellent content. And I thought you'd be perfect to answer this since you are also from Canada.
Yes, Canada, go Canada. So yeah, we didn't really have time to talk about all the conditions, but I do think there is definitely a huge niche in healthy eyes. So high ametropes, high hyperopes, high myopes, astigmats. Basically, these patients are going to see a lot better with a specialty lens. Why? Because regardless of whether you're fitting a hybrid lens, you're doing orthokeratology, you're doing a scleral lens, you are customizing this lens. So basically, this is fitting this specific patient. The lens will be more stable, it will be more comfortable, better wearing time. And some of these lenses allow you to correct myopia, astigmatism, presbyopia, everything in one lens, which we don't have a lot of disposable lens options for. So, and some of these lenses, like some of these new hybrid lenses on the market, actually are neutralizing corneal astigmatism. So if you have a patient with hyperopia or myopia, and astigmatism and presbyopia, then that's a great option. So I think there's a huge market for you if you're doing just regular ametropias, even patients with dry eyes, but let's say otherwise healthy, they don't have irregular corneas, will do extremely well with scleral lenses. That's a huge niche. I think there's a lot of opportunities in patients who don't have corneal irregularity. And again, one size does not fit all. And now that we are being and will be eventually replaced by vending machines, as I mentioned originally, and websites and huge chains, I think we need to specialize, all of us, and even for patients with regular corneas.
Amazing. Well, thank you, Dr. Kramer, for all of your insights. I'm excited to ask you a few more questions at the end of this program.